Hi, this is Dr. Luke at Clearsight Center in Oklahoma City. And this is how I perform the combined LASIK and KAMRA procedure. So I start by using a small instrument to mark the cornea, and this is going to help me with the future pocket placement for the implant. Use a surgical sponge there to make sure that there's no debris. And here I have the patient look straight ahead, right there at the green light, and place a 4mm circle, which helps me with the future placement of the camera inlay. And I remove any excess fluid which can affect the placement of the laser. And here we see the Zimmer laser. And we're going to do two passes. The first one is to create the camera implant pocket, and that lasts somewhere between 30 and 35 seconds. Now I absolutely love this laser. It is fast, it is precise, accurate, and it uses a very low energy. And it's also very versatile for other forms of corneal refractive surgery. Now the patient will be feeling some pressure, but really no discomfort given the anesthetic drops that I had provided earlier. Now, the Zimmer pocket has just been created, and now I'm going to create the LASIK flap. The LASIK flap is nothing more than a natural bandage to allow the vision to come back quickly after excimer laser ablation reshapes the eye into better focus. Now, again, the patient will feel some pressure, but no discomfort or pain. And here I'm creating approximately 110 micron flap, which I will be lifting later in the procedure. Okay. So now that the Zimmer laser has fired twice, we have two planes, one for the camera inlay and one for the LASIK flap. I start by using a small instrument to remove the excess gas and bubbles, and that just helps me with visualization during the procedure. I then clean the instrument and use it again to open the pocket for the implant. Now we want to be careful not to get any blood into the interface, and so here I'll be using a surgical sponge to remove just a very, very small amount of blood. Perfect. So here I use a camera spatula in order to open the pocket and break the remaining adhesions inside the pocket. I tend to use a sweeping motion, which I find has been easier and created less inflammation than other techniques, at least in my hands. And here I ask the patient to do his or her best to just look straight ahead. I may be moving the eye, and the target may appear to be dancing around. The next thing I do is place the camera inlay. Now I tend to overshoot a little bit and then pull back, placing the implant right there within the previous circle that I had marked or created. Now, as long as I don't remove the forceps, I'm able to adjust the implant in order to make it or create it perfectly over the patient's visual axis. Next thing I do is make sure that any excess fluid is removed and that the pocket was closed. Then use this instrument to lift the LASIK flap. And similar to the pocket, I use this instrument to break adhesions. And you can see that this is in front of the implant. I then use this instrument to reflect or lift back the flap. I center the eye under the EX500 laser, apply the treatment to bring the eye into focus. I actually want to make the eye slightly nearsighted to make the implant work better. I apply BSS, which is nothing more than a form of saline solution, and then reposition the flap. Now, I want to make sure that there's no debris under the flap, which can cause inflammation or could potentially affect the patient's vision. There's a steroid here, as well as a surgical sponge to make sure that the flap is in perfect location. There's a natural pump in the eye called the endothelium, which helps hold everything in place. And I'm just making sure that it's well positioned while I wait for that pump to take over. Here I use another surgical sponge in order to check the gutters, which are the edges of the flap. And here everything looks perfect. And I check one more time, asking the patient to look straight ahead right there at the green blinking fixation light. Apply a drop, look with the light, apply a contact lens, and that is it.